I, Dr. Subrata Bhattacharya, one of the senior most consultant physician, the district of Bardhaman, and I mainly now engaged in the practice in the diabetes and the cardiology section. And regularly, I have to attend so many diabetic cases.
How does Imeglimin fit into your regular practice with the current landscape of type 2 diabetes treatment options? Kindly share your experience.
In recently, or just first recent, there are so many. They introduced several oral anti-diabetic drugs and some newer insulins. But still now, there is some gap. Some patients are not corrected or controlled by the regular oral anti-diabetic drugs or insulin. So there remains some gap. So Imeglimin and lastly Imeglimin came in the market. The Imeglimin offers a novel approach to the type 2 diabetes mellitus management by targeting the mitochondrial function, which is distinct from the mechanism of traditional anti-diabetic drugs. Its ability to enhance the insulin secretion and sensitivity, inhibits the hepatic gluconeogenesis, and supports the pancreatic beta cell function, makes it a valuable addition to our treatment arsenal, particularly for patients who have not achieved the optimal control with the existing therapies. We know that the type 2 diabetes mellitus are the results of both decreased pancreatic beta cell secretion of insulin and also the insulin resistance. And Imeglimin acts in both the targets. That is why this molecule creates some very much interest in the field of management of the type 2 diabetes.
In what specific patient populations do you see the greatest benefits of using Imeglimin?
Particularly where the traditional oral anti-diabetic drugs are not sufficient to control the diabetes, or addition of the insulin. In some patients, there remains some gap to control the diabetes or blood sugar. Particularly, Imeglimin is beneficial for patients who have uncontrolled hyperglycemia with multiple metabolic dysfunction, such as those with significant insulin resistance or those at high risk of diabetic complications. It also offers a promising option for patients who experience the adverse effects like GI intolerance with other medications, particularly metformin, high-dose metformin, or other drugs, and also require the additional glucose-lowering agents to achieve target glycemic control. Particularly in those cases, the Imeglimin serves the purpose.
How does Imeglimin compare to other hypoglycemic agents in terms of safety and efficacy? Kindly share a real-world case, if any.
I have used in so many cases Imeglimin in addition to metformin, sulfonylureas, even gliptins and flogins. But in almost no cases I have found any complications, and its safety profile is high. In my clinical experience, incorporating the Imeglimin as individual and also as add-on reduce the doses of existing medications or reduce the dose of insulin. So, patients have shown the improvements in the glycemic control without experiencing significant side effects like the gastrointestinal issues or hypoglycemia. It has proven effective in reducing the need for other diabetic medications and even the basal insulin doses it can reduce in some cases. It is the dual action on insulin sensitivity and insulin secretion, along with its mitochondrial mechanism, provides effective blood glucose control. Most important part to highlight is that imeglimin ensures the glucose-induced insulin secretion as well as protects the beta cells and preserves. This is very important uh, beta cell mass. Moreover, the imeglimin reduces the hepatic gluconeogenesis and increases the glucose uptake in the muscles. So, additionally, imeglimin has shown synergistic effects when combined with the other anti-diabetic drugs, making it a versatile addition to the existing type 2 diabetes mellitus treatment regime.
In recent time, Imeglimin sustained release formulation with Indian study has been launched in India. What is your opinion on that?
Clinical studies indicate that imeglimin sustained release has a better safety profile like the lesser GI tolerance, side effects with tolerability and efficacy, also compared to the metformin SR. As per the Indian study with imeglimin SR, there are 50% lesser GI side effects than the metformin SR, whereas efficacy was at par. Again, another is the compliance. In SR preparations, the compliance is better. I have used in some of my patients and have seen the benefits like the better tolerability and able to reduce the dose of metformin from 1000 milligram BD to 500 milligram BD.
How does the mitochondrial targeting mechanism of imeglimin influence its clinical use?
Main mechanism of action of the imeglimin is the mitochondrial function is crucial for cellular energy production and the metabolic regulation. In type 2 diabetes, mitochondrial dysfunction is a common underlying cause that contributes to the insulin resistance and impaired glucose metabolism. By targeting and improving the mitochondrial function, imeglimin addresses a fundamental aspect of the disease, helping to restore the normal metabolic processes. This unique approach not only aids in lowering the blood glucose levels, but also has the potential to improve the overall metabolic health and reduce the complications associated with the type 2 diabetes mellitus.
What are the key safety and efficacy findings from clinical evidences on imeglimin that clinicians should be aware of?
When it comes to safety, the number one, lesser GI side effects, and number two is the better tolerability. When it comes to efficacy, ideal for as an add-on to reduce the dose of existing medications or insulin. So, clinical studies have shown that imeglimin has a favorable safety and efficacy profile with significant glucose-lowering effects and a low incidence of adverse effects. Its ability to synergize with the other antidiabetic agents enhances its appeal for combination therapy. Additionally, imeglin's potential to mitigate the diabetic complications such as metabolic cardiomyopathy and diabetic neuroinflammatory further supports its role in the type 2 diabetes management.
Do you believe that imeglimin has the potential to change the future landscape of diabetes treatment?
Yes, the imeglin could significantly impact the future of diabetic treatment by providing a new mechanism of action that complements the existing therapies. So, its benefits in improving the mitochondrial function and potentially reducing the diabetic complications. The diabetic complications position it as a promising option for more comprehensive diabetes care. As research continues to unfold, the Imeglimin may become a cornerstone in the management of type 2 diabetes, particularly for patients with the complex metabolic needs. Imeglin's favorable safety as well as tolerability and efficacy make it a valuable option in the comprehensive treatment plans for type 2 diabetes.
Any other key point or take home messages you would like to share apart from this?
Particularly uncontrolled diabetes. Patients are taking the sufficient dose and sufficient medicines like metformin, sulfonamides, or the gliptins or fluoxetines, but that control, or even after insulin, the control is not enough, or they are some patients are very prone to develop the diabetic complications. Particularly in those patients, Imeglimin is a hope for their better treatments.